Well, good afternoon, everyone, and welcome to Public Health's virtual education series, Wažookį, Family Conversations. I'm Renelle, public health nurse, joined by Jamie, public health worker supervisor, who will help me moderate today's session. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. A quick announcement for today: with public health summer block parties happening on Wednesday, our schedule going forward will be a little different through August. So please keep an eye on your TOB emails, the Wažookį, and our Facebook page for updated schedules for this summer. Today, we're happy to be joined by Laurel Meek, Head Start Director, here to talk to us about giving our kids a head start. We'll have about 45 minutes for Laurel's presentation, followed by a Q&A. Please use the chat function to enter any comments or questions for our presenter. Jamie and I will monitor the chat throughout the presentation and read the questions for her at the end. You can also raise your hand and come off mute during the Q&A to ask your questions out loud. Any questions that we don't have time for, we will forward to Laurel and then bring back to the group. This session is being recorded and will be posted on the Department of Health website under the Public Health Division tab and on our Facebook page. Everyone, please welcome Laurel.
Years now, and so I'll go ahead and get started. It has been, I guess you could say, my life. So giving our kids a head start. The Ho-Chunk Head Start's mission statement has been developed by parents and staff from the program. So our mission is: the Ho-Chunk Head Start program embraces each family's individuality and fosters each child to grow physically, intellectually, socially, emotionally, culturally, and spiritually. So what is Head Start all about? Head Start began as something that I'm sure you all recognize, and that is Sesame Street. It was in everyone's home, and so it was just a tiny little section of time that got all kids on the same page, you could say. So it has evolved into a huge, huge program across the nation. And our little program here serves 120 children. And we are part of what is called the American Indian Alaskan Native branch of Head Start. The difference, you can move the slide, Renelle. So the difference between Head Start and other preschool programs is that Head Start is an all-inclusive program for children and families. I'll start by sharing with you what our Ho-Chunk Head Start enrollment priorities are. So any child who starts Head Start and it continues to be age eligible is guaranteed a second year. So all returning students are guaranteed their position for a second year and are enrolled. For open positions, tribal children are chosen first. For tribal children, this is a recent development, income is not considered. So all tribal children are eligible for an American Indian Alaskan Native program, which the Ho-Chunk Head Start is. So secondly, children that are income eligible are chosen. So income eligible is at or below poverty guidelines. Next, children that are considered by the Office of Head Start to be categorically eligible are chosen. And that is families who are on SNAP, families who have TANF as an income source, children who are foster placed, children on SSI, and also homeless children. Those are all considered categorically eligible. Also, Head Start programs need to serve minimally 10% of their children of the enrolled total that have a diagnosed and documented disability. It is often the case in our Head Start program that we are closer to 20 to 26%. Children that are over income then are chosen last. And because we're a tribal program, we can go up to 49% of our total enrollment that are over income. We enroll throughout the year so that we can ensure fully funded enrollment levels. And next slide, please. So one of those all-inclusive things is health. So prior to enrollment, we do ask families to provide us an immunization record. That is a requirement of our state licensing and also the Federal Office of Head Start. So we do have to have that ahead of time or a waiver of immunization. If children have not previously had vision and hearing screenings, our Head Start program, in combination with Lions Club and our great community health nurses, will assist in making sure that it is completed for each child. Also, if children have not previously had dental screenings, the amazing Ho-Chunk Nation dentists visit the centers within the first 90 days of the beginning of the year to provide this service. And next year, it sounds as though they will be able to be at our parent orientations to capture a dental screening for any child who does not currently have a dentist or has not seen a dentist in the past. Also, from the dental program, hygienists visit our centers 3 times per year. And for families who are giving permission, the children receive 3 fluoride treatments throughout the year. If children have not previously had a well child check, our family service staff assist the families in making appointments with the Ho-Chunk Healthcare docs to ensure that appointments are scheduled for families within 90 days of the start date. If transportation is an issue for families, we will provide transportation to those appointments. The magical 90-day mark there is one set by the Office of Head Start. If assistance with finding follow-up care is required, our family service folks will assist with that as well. Of course, school readiness is a big thing in Head Start. So we are here for this as well. This is one of those comprehensive services. So our curriculum, our educational guidelines, our school readiness goals are all in place, and they're based on developmentally appropriate practice. Federal requirements for school readiness, as well as Wisconsin early learning standards. Initial screenings are completed with parents to establish a baseline of development for each student using an ages and stages screening tool. This is done so that our instruction can be individualized from the very beginning. Ongoing assessment is provided using Teaching Strategies Gold, which is a teacher observation child demonstration model. So it's ongoing. It's not a moment in time. It's not one day that we do the assessment. It's over time. And all of our teachers are certified in order to provide that assessment. That is a nationally normed assessment. Outcomes of the three assessments, the three assessment periods, are shared with parents at parent-teacher conferences. Child assessment data is also evaluated within our organization to determine any needs that we have for staff development. If we see an area where children are not progressing as quickly as we had hoped, then perhaps it is that we need additional professional development. And so that is another thing that we use that data for. And assistance with transitions to the big school is provided to each family as well. Another area, like I said, we do serve children. We are required to serve children with disabilities, and we have had much success. We provide advocacy services to families with children with diverse abilities. Partnerships are maintained with all of our local school districts in order to provide IEPs as well as services required to meet the needs of the children. Also internally in the education department, we are fortunate to have Dr. Funmaker, who assists in that advocacy. So if a school district isn't providing what a child needs, Dr. Funmaker is able to step in and assist us with that. The IEPs are implemented within our Head Start centers in conjunction with services that are provided by the school district, so that the child is around, like across the board, getting the services that they need. As services are required outside of the Head Start Center, for example, if a child needs to be transported to the school district in order for a particular service, we do provide the transportation for that. Another area of service, obviously, is nutrition. So the nutritionists come from the Ho-Chunk Health Care Center, and they provide little samples and getting children to consider healthy choices. And we ourselves participate in the Child and Adult Care Food Program, and which ensures that every child receives the minimum daily requirements and more than the minimum. Meals are prepared from real food. Children receive breakfast, lunch, and snack. And there's never lunch money required from a family. All Head Start children are considered in the free category of the Child and Adult Care Food Program. Family services. This is a big thing, I think, that sets Head Start apart. Families are encouraged to participate in Head Start. I know a lot of the centers do fundraising, which Head Start staff cannot be a part of, but they do all kinds of different things. We have different events. We have Mother's Day events. We have Father's Day events. Come and share a meal with us. Come and share a story. All the way from those types of things to program governance. So like each of our Head Start centers has its own like local parent committee, and that is comprised of all of the current Head Start parents. Then from that group, they select a policy council rep, and those policy council reps are part of the governance structure of the Head Start program. And so without that policy council and without parents involved in that, Head Start can't exist because our parents have to be part of planning budgets, of setting policy, of setting selection criteria, of all the things that make Head Start Head Start. And without their approval, we can't even hire anyone. And so parents play an extremely important role in Head Start. I sometimes liken our policy council to what a school board is, but more. So all families receive an orientation to the Head Start program prior to the start of the school year. Partnerships with community and Ho-Chunk Nation agencies are maintained to ensure services are provided to the families as needed or requested. Some of those things are they're really too numerous to mention, but I'll just mention a few. Again, going back to CHNs, to our dentist, to our hygienist, to Miss Ronell, who was like our key contact during COVID, keeping us safe, reviewing our policy and our procedure for controlling that situation, all the way to providing car seats to the children, providing staff that are trained in installing those car seats. And some of our staff are currently sitting in that training, just about to wrap that up. And tomorrow they will be wrapping that up. And then on Friday, we have staff that are getting recertified in being able to do that. We've also received bike helmets and life jackets for children, and all of those at no cost to our families because of those wonderful connections. And as I said before, parent involvement in all areas of the program is promoted and encouraged and celebrated. So, and additionally, advocacy services for any families. If work is required, if job skills are required, if education, if food, very, from very basic to broad, we have a lot of resources that we can assist families with. So of the few of the partnerships, we have many, but all of the local school districts in our service areas. So with that, what they provide is, like I said, the individualized education plans, etc. In some of our areas, our children dually enroll in 4K and Head Start. So we provide transportation to those 4K services. However, in our Black River Falls area, 4K is provided right within our center. We also partner with community health and human service agencies in our service areas in order to be able to assist families with resources that they have access to. Birth to 3 programs, Lions Club, and our CHNs and the nutritionist and dietitian. Those folks, our exercise physiologist also comes to the center and provides yoga, which is awesome. Ho-Chunk Nation Dental and Medical Services, environmental services. They do so much for us, and that's where a lot of the safety things come from. It's also where the folks there inspect our centers and ensure safety, along with the Department of Labor does inspections annually on our centers. We also have partnerships with UW Extension programs that provide some really neat educational opportunities and other opportunities for families. Wisconsin Bookworms is a program that comes into our centers. They come monthly all throughout the year, and they read stories for the children, and then each of the children get a copy of the book that they read so that they can build their home libraries. The Edgewood College nurses down in the Wisconsin Dells area are able to provide some services within the center for health purposes. And again, 4K. My first book is another program to build children's libraries. The CISA agency provides coaching for our staff. And the Alliance for Infant Mental Health is a very recent, just this year, that we joined with them. And they provide a lot of ideas on self-regulation, on mindfulness, on all sorts of topics, mental health. And we've implemented their services for our staff as well. And so we just wrapped up our last session. So learning how to monitor ourselves as well, so that children learn about regulation by watching their teachers. And next, we have multiple funding sources. We have our primary funding source is a federal grant through the Administration for Children and Families Health and Human Service Office. We also have a state grant that is through DPI, but within the last year, it is operated through the Department of Children and Families. We also have a Department of Public Instruction Child and Adult Care Food Program grant, and that is a reimbursement grant. And then, of course, we have tribal funding coordination.
I have no idea.
Small donations that come in here and there, and not so small. Domtar in Wisconsin Rapids has been just an incredible supporter of the program, as well as Fox Valley, in terms of creating the gardens and multiple other projects that they have been a part of. So just want to make sure to mention them here as well. And finally, so why choose Wažookį Head Start? So we have within the Head Start program what is called a classroom assessment scoring system. And this is the Office of Head Start that has developed this. And it is a measure of 3 domains and 10 dimensions of teacher-child interactions and measuring those observed interactions. So when we look at this chart, and this is, I forget what President Green said one day, or why he said it, but he asked me, "Are you sure this isn't lipstick on a pig?" And I'm like, "Yep, I'm pretty sure." So what this is again, it's a national scale. It is not something we do ourselves. It is a federal review. And so when we look at these different areas, we look how our teachers stack up nationally. So the domains that are covered are emotional support, classroom organization, and instructional support. So if you look below, emotional support is those things that are encompassed in positive climate. Of course, we don't want negative climate, teacher sensitivity, and regard for student perspectives. In classroom organization, we look at behavior management, productivity, and instructional learning formats. And the last area is instructional support, which looks at concept development, quality of feedback, and language modeling. So concept development with 3 to 5s is extremely difficult. It's hard to conceptualize things when you're just learning language and you're just learning about your place in the world and who you are and all of the things. And so when you look at The threshold for tribal consultation is a 5 in emotional support. And our Head Start program, being a tribal program, came in at 6.4375, which you can see there in the chart is above the highest 10% nationally. When you look at classroom organization, you can see that the threshold again is 5. A quality threshold is 6. The median nationally is 5.8. The highest nationally, the highest 10% nationally is 6.17. And our very own Ho-Chunk Head Start teachers came in at 6.4167. So again, above the highest 10% nationally. And then 2.3 is the threshold for tribal. The quality threshold is 3. The national median is 2.94. And the highest 10% nationally is 3.52. And we came in just under the highest 10% on that, but definitely above the median, the quality, and our the tribal program threshold. So pretty awesome teachers. They stack up very well nationally. So moving to the next slide, I can show you. So far we have our fall baseline, which is an October assessment, and then our February assessment. And these are the growth outcomes that you can see so far. I do not have yet the total spring outcomes. And these are our children's progress towards school readiness. So you can see in the fall that there was very, very little, very few, little percentage is what I'm trying to say, that were exceeding expected growth goals, growth outcomes. There were quite a few meeting, but there were also quite a few not meeting expected growth goals. So as we jump into mid-year, look at the growth that the children made. Children moving out of that not yet meeting into both meeting and exceeding. I just love to see that green line, those green and red lines moving up like that. So just amazing progress. And I'll be excited to see once all the data is input in our teaching strategies gold, I'll be able to produce our spring outcomes. And I know they're just going to be off the charts. So how do I apply for the Ho-Chunk Head Start? We have come into this century and we now have not the big old packet that you have to apply with. Our second year students don't even have to apply. We just move them from 1 year in Child Plus over to the second year. So all new applicants can just go to the link that is there or click on the QR code and the application is right there and it is super simple. And so exciting stuff. As of June 3rd, when we first started our enrollment, we had on that day 134 applications already. So with our first round of acceptance letters going out, those will be for the students who are returning and also for Ho-Chunk students. We're just verifying a few more. We have a few more on our list today. And so as of yesterday, we had sent out 67 letters, and today we have like 7 or 8 more going out. So we are filling fast and encourage you to get your applications in, encourage folks to spread the word that it is Ho-Chunk priority or other Native American tribes. So that is our priority. service group, and we will be starting a next round of enrollment the first week. Well, actually, we're ahead of the game, but we are hoping to be fully enrolled by the end of July. And at that time, if the center isn't full with returning and potential children, at that point, we will save a spot at each center for an application that may come in late. However, as of August, we need to be full. And so, because our first day of school is August 25th, and we need to be full on that date. So we can't hold, but like I said, we do accept children throughout the year, and certainly do have movement where children move out of the area, and we like to be able to fill that spot right away. So that is all I have for you. Any questions, comments?
Don't see anything in the chat yet, but if anyone has any questions for Laurel, please feel free to come off of mute. Oh, we just lost your audio, Laurel.
Are we good?
There we go. Yep.
Okay. So please feel free to reach out to me as well. It's just laurel.meek@wažookį.com. And I'm happy to answer any questions. And again, our application process is far, far simplified. You will not be getting any paper where you have to fill out a giant packet. So, right.
Just take a moment to see if anyone has any lingering questions. Somebody's typing away real quick.
I didn't put in the presentation is that all centers do provide bus transportation. So something that is important to parents, I think, and also that our service hours are our instructional hours are 8:30 to 3. So kind of a long day for kiddos, but it is a somewhat new requirement. So
I just put the link to the application in the chat.
well, I appreciate you giving me this opportunity, Renelle, and I will be out at somebody from Head Start will be out at the rest of the block parties. So I'm happy to answer questions there as well.
All right. Well, Pinagigi, thank you, Laurel. It's great to hear about all the amazing things that all of you are doing at Head Start for our young kids. And thanks everybody for joining us today. As a reminder, this session is recorded and will be available on the Department of Health website under the Public Health tab and on our Facebook page. We look forward to seeing you all at our next session, which will be on Wednesday, June 25th. We'll be hosting Heidi Neely from the Alzheimer's Association, and she's going to talk to us about keeping our minds strong, understanding Alzheimer's, and reducing risk together. You can use the same link as today to join all future sessions, or to add the recurring WebEx links to your calendar. You can email Jamie and I, and we will send that to you. I have just put our emails in the chat if anyone needs those. Otherwise, thank you, everybody. Have a good rest of your day.